Helminths and anti-helminthic drugs. What are helminths? Helminths are multicellular organisms that infect humans and animals. Mostly infected helminths are roundworms, flukes, tapeworms. Anti-helminthic drugs. Albendazole. It is benzimidazole carbamate. Albendazole sulfoxide is active metabolite. Broad-spectrum anti-helminthic drug and inhibit microtubule synthesis. Drug of choice for ascariasis, trichuriasis, strongyloidiasis, hookworm, cysticercosis. Albendazole also has larvicidal effects. Oral absorption increased with fatty meal. For intraluminal parasite, it is administered empty stomach. Dose, for adults, 400 mg orally for 1 day in case of light ascaris infection, 2 to 3 days for heavy infection. ADRS, epigastric distress, diarrhea, headache, insomnia, increased liver enzymes. Pyrantel pamoate, broad-spectrum anti-helminthic drug highly effective against pinworm, ascaris and Trichostrongylus orientalis infection. Moderately effective against both species of hookworms. Effective against mature and immature forms of susceptible helminths within intestinal tract. It is neuromuscular blocking drug that causes release of acetylcholine and inhibition of cholinesterase. This results in paralysis of worms, which are then expelled. Praziquantel should be taken with high carbohydrate meal. Praziquantel increase permeability of trematode and cestode cell membranes to calcium, resulting in paralysis and death. Schistosomiasis 20 mg per kilogram per dose for 2 or 3 doses at intervals of 4 to 6 hours. Neurocysticercosis 100 mg per kilogram per day in 3 divided doses for 1 day, then 50 mg per kilogram d to complete 2 to 4 weeks course. Hymenalepis nana drug of choice in this condition. Dose 25 mg per kilogram is taken initially and repeated in 1 week. Adders, myalgia, urticarial, arthralgia etc. Oxamniquine. It is alternative to praziquantel for the treatment of S. mansoni infection. Active against both mature and immature stages. Contraction and paralysis of worms. Dose is 12 to 15 mg per kilogram once or twice daily for 2 days. Adders, colic, low-grade fever, proteinuria, discoloration of urine. Niclosamide, second-line drug for treatment of tapeworm infections. Minimally absorbed in GIT. Inhibit oxidative phosphorylation or stimulation of ATPase activity. At dose 2 grams, cure rate is 85% for D-latum and 95% for T-solium. Adders, abdominal discomfort, nausea, diarrhea, vomiting etc. That's all for today.